Hello, I'm Paul Peterson. Modern medicine offers advantages never before seen, and yet children born after the year 2000 are actually expected to live shorter lives than their older siblings. That's a startling statistic that does not bode well for the next generation that will become senior citizens in the middle of the century. Our guest today, an expert in the treatment of diabetes, blames increasing levels of obesity and inactivity for the onset of diabetes and heart disease among today's senior citizens. Please stay tuned for Aging in LA. Years ago, physicians knew little about how to control or manage diabetes, whether it was type 1 or type 2. In type 1 diabetes, the immune system destroys the body's insulin-producing cells called beta cells, and sufferers must eventually use insulin. In type 2, the body becomes resistant to the insulin made by beta cells, so glucose, which is a type of sugar, gradually builds up in the blood. Today, physicians recommend adopting a better diet, weight management, exercise, and blood sugar control to help control this spreading disease. In the United States, almost 20% of persons over 60 years of age have diabetes, and the prevalence of the disease increases with age. Seniors face unique diabetes management challenges. Today's guest, Dr. Ann Peters, is professor of medicine at USC. Dr. Peters directs the USC Clinical Diabetes Program and sees patients at the USC Westside Center for Diabetes and the Edward Roybal Comprehensive Health Center. Dr. Peters urges Americans to get off the couch and take control of their own health. Thank you so much for joining us, Dr. Peters. It's a pleasure to have you here and to talk about the increasing risk of diabetes. What's going on?
Well, our environment is changing for the worse, or at least changing in an opposite way that our genes are meant to be. So if you think about it, we've had our genes for generations,
Yes.
but we haven't had this rate of diabetes, and our environment is becoming one where we have way too much food and way too little exercise, and so these genes that once helped us survive famine are being expressed as a disease that is diabetes.
Wow. And when you say environment, it's not just like the continuing presence of food, but sometimes it's just the wrong darn food and too much of it.
Well, yes, because food that tastes good tends to have a lot of sugar and fat aren't necessarily the best things for us. It's much healthier to eat fresh fruits and vegetables.
Wow. Well, a technical question. How early can diabetes be detected? I mean, is this a genetic thing, or is there a test to see if someone's either at risk or has just started to manifest signs?
Well, you ask many questions.
Yes,
but
I
let me
did.
tell you the first.
Okay.
There is a genetic risk because there's certain populations that are more at risk. So if you're Latino, if you're African American, Asian, Native American, those are all higher risk. And in addition, if you have a family history of diabetes or heart disease, those are people who are also at risk. But as people get older, everybody becomes more at risk no matter what ethnicity, because as you get older, your body becomes more resistant to insulin and the risk goes up. So you can actually get diabetes at any age. So the youngest person in LA County with type 2 diabetes, or what we used to call adult onset diabetes, is 2 years old.
Oh.
And she's a little girl who had both parents with diabetes. She's quite overweight, and she got the genes.
Oh,
Now,
two.
The other flip side, though, is that we used to think that only kids got type 1. And in fact, my oldest patient with new onset type 1 is 93. So any type of diabetes can happen at any age. But when we talk about the diabetes that gets worse as you get older, it's in general the type 2 the kind that gets worse as you're not exercising as much, as you get a bit heavier,
Sure.
and especially as you get heavy in the middle. That's a bad place to put fat.
Well, you're talking about me. Doggone it. Well, men we pack on weight in our abdomens, and women in the hips, and no?
Postmenopausal women,
Right.
if you ask where are they gaining weight now, they will say, I've now been starting to get weight in the center.
Really?
And postmenopausal women also get heart disease at much higher rates than women before menopause. So I see a lot of people as they age, it sort of becomes more equal in terms of some of that fat distribution, particularly in women who are at risk for diabetes.
Well, we have to talk about this epidemic of obesity. Before the show got underway, we were talking, it's everywhere now. You're seeing grossly overweight people all around us, and we ourselves have become accustomed to packing, an extra 20 pounds here, 25 pounds, I'll take it off eventually, and you never do.
Well, there are several things, and there's a lot of issues about this. We were meant to have a discontinuous food supply.
Right.
And probably the best way to be is to be a little bit starving all the time. Because those people actually live the longest. But with excess food, there's the issue of being overweight and thinking you're not attractive versus being overweight and unhealthy. And the problem is in people who are prone to get diabetes, just 15 to 20 pounds can make the difference between normal diabetes, normal sugars, and abnormal. But the flip side is that if you're at risk for diabetes, and you asked me this question earlier, how do I know? You know because of your family history. You know because you check your fasting blood sugar, which means the blood sugar before you eat breakfast. And basically, if it's above 100, that means you either have pre-diabetes, or above 126 means you have diabetes. If you find out you have pre-diabetes and you lose 7% of your weight, which is in general about 10 to 15 pounds,
Right.
you can prevent ever getting diabetes. So it's not like you have to go down from 250 to 150. It means you have to go from 250 to 225, and your risk is markedly reduced.
That's a hopeful sign. We recently followed one of Dr. Peters' patients when he came in for a checkup. Dr. Peters, if you'll please describe the procedures that the patient is going through.
Okay, so here's the patient. He's coming in and we're weighing him because he, like most people with diabetes, is struggling with his weight.
Right.
Cindy's taking his weight and comparing it to his last weight. She's now checking his blood pressure, and people with diabetes are at very high risk for high blood pressure, and it's even more damaging in people with diabetes than without.
Right.
Now she's recording the blood pressure reading and comparing it to what it should be, and his is 140/88, which is actually a bit too high. She's now checking his blood to measure both his blood sugar and what's called a hemoglobin A1C test, which is a 3-month average of his blood sugar levels. And ideally, that should be less than 7. Normal is a range of about 4 to 6. And in our lab, we're able to get the blood test results back immediately. Here I'm examining his nervous system because patients with diabetes lose their nerve function, which leads to a high risk of amputation. They also lose blood flow to their feet. And now I'm checking in between his toes to make sure he has no cuts or lesions. And basically, people with diabetes should check their own feet every single day to be sure they don't have any problems, any cuts or sores that would need a doctor's attention.
So this lack of sensitivity can lead to a cut, and that could lead to big problems?
Well, absolutely. It's because people can't feel things in their shoes. You know, a sense of touch tells you that there's something bad that's going to hurt you. So if you can't feel your feet and you get a thumbtack in your shoe or a piece of glass, you may not know it until it's embedded there and infected.
Wow. Well, of course, that makes complete sense. And then the infection, it's just like a cascade of ever more serious problems then facing you.
Well, absolutely. But like many things with diabetes, it's preventable if people do the right things. So if people check their feet every day, if people see their doctor regularly, have their feet checked, do those things, they don't ever have to get into trouble. People with diabetes don't have to go blind. They don't have to get amputations. None of that has to happen if they get good preventive health care.
Well, let me ask the core question. Can diabetes itself be prevented? I mean, can you, starting early in your life, if you know you have these risk factors, can you prevent the onset of this disease completely if you live right?
Absolutely. And
Oh,
in
see?
fact, in not all cases though, but in many, we believe you could actually prevent it. For many people who are overweight, losing weight and becoming physically active, but not going on a diet. I don't believe in diets. What you're going to do is change your habits to healthier habits.
Right.
And it turns out that they've done studies in which they included older Americans and compared their ability to prevent diabetes through lifestyle with younger, or they were part of a spectrum. And what they found, they thought the older individuals wouldn't change.
Right.
They did better.
Oh, see?
And they were better able to prevent diabetes in part because maybe they had more time, or maybe they understood the value of preventive health care.
I like to think
But
the latter is the case.
you
'Cause
can
it's
do
like
it.
a challenge. Why not? I have seen seniors turn their lives around, especially if they're looking at their own mortality.
Well, and just being healthy. And I think that for everybody, young and old, it's possible. And people just need to be aware of their risk. They need to know what their fasting blood sugar is. They need to know their family history. They need to know that they could get this disease so that they can prevent ever having it.
Well, is this standard operating procedure when a senior comes into a health center? Is part of the workup, if you will, to help identify the potential signs of diabetes?
Well,
Or do you come in with a condition? That's really what I'm asking.
most of the time people don't have any symptoms. And unfortunately, most of the time if you come into a healthcare system because something hurts. Your knee hurts, your
Right.
hip hurts, your head hurts. And the doctor gets these blood tests and they say, oh, you're a little abnormal. If I had $1 for every person who came to see me because they had a little diabetes, I'd be a multimillionaire. There's no such thing. It is or it isn't. You either have a risk or you don't. And so you need to know your own numbers.
Okay. Dr. Peters, we have some pictures of medicines that control cholesterol and blood pressure. Can you talk about these prescriptions, please?
Well, certainly. So the first set are drugs that control cholesterol. And pretty much everybody who has diabetes should be on a drug to control their cholesterol level because people with diabetes get heart disease at 2 to 4 times the rate of somebody without diabetes.
Wow.
And these are all the pills that can control cholesterol. This is Lipitor, which is one that we use often. It's a form of a statin drug. This is a combination drug with a cholesterol and a blood pressure lowering medicine. And that's important because most people with diabetes end up on at least 10 medications to prevent diabetic complications. So if you can combine them, it often makes it easier to take. So that was cholesterol-lowering drugs, and now we're into blood pressure-lowering drugs. These are drugs of the same class, which actually not only lower blood pressure, they help prevent kidney damage. And everybody at risk for diabetes should have tests of their kidneys done at least once a year and will likely end up on one of these medications. But again, they don't only help with blood pressure and kidneys, they help prevent heart attacks and strokes. This is Altace or Ramipril, which is one that's been well studied and is quite effective. This is a drug for congestive heart failure, which can be a problem in patients with diabetes, and this is another drug for treating blood pressure.
It's just amazing when you said people with diabetes can be taking up to 10 medications at a time. We wonder where the healthcare costs are going. This is amazing, and they all interact together, and it's been carefully studied.
Well, yes, but first of all, I resent that you're saying costs go to my prescription drugs. My prescription drugs aren't what's expensive. It's the complications of diabetes that cost so much.
Well.
So it's much better to take these, and some of these can be got as generic drugs, which are much cheaper
Right.
than the brand name drugs. And we have done smaller studies, and there's some big trials with combinations ongoing. But if you take each one of these and add them together, they, as a total group, will lower your risk. But you have to be smart, and you have to always ask your doctor and possibly your pharmacist, as maybe your best resource, do all these drugs work together? Because you
I
don't want to get the
understand.
wrong mix.
Well, and I am mindful of what you said. It's the complications that would truly be costly when you compare to the cost of the drugs. Now, you also have some samples of medicine that control blood sugar. Let's take a look here.
So we have lots of new medicines for controlling blood pressure. There's Januvia. This is actually an old medicine with a new name, and it's a long-acting form of metformin. Metformin is the first drug that we start people on when they get diabetes. This is a combination of pioglitazone, which is Actos, and glimepiride or Amaryl. This is a combination of Avandia and metformin. Again, combination drugs are helpful because it means you take fewer pills, but you really want to mix and match the right drugs. And here's Actos, again, as a pill.
Well, it's often challenging for seniors who have a bit of reluctance to take medications when you're talking so many drugs, and there's a discipline to that, and many times there can be a decline in mental function, and taking medicines can be difficult. Are we working on that too, to help people learn some new rules of taking their medications so they're careful and know that on this Wednesday I took my Wednesday drugs?
Well, there's all sorts of devices and ways that people are getting pills dispensed and things, but more than anything, there's a psychological sense, in my experience, that people feel like drugs are a failure. And with diabetes, I say, thank goodness we have these pills. These pills not only can help prevent you from dying sooner, they can also prevent you from going blind and on dialysis. And I don't care how old you are, if you have, any number of years you plan on being around, you don't want to get those complications.
I understand. Now, there have been great strides in the methods of injecting insulin. So would you describe some of these treatments that we're going to see?
Yes, so we now have a whole bunch of different kinds of insulin, and what you see in this picture, a number of different vials. Each colored top represents a different kind of insulin.
Right.
This is an insulin pen, which I actually think is a very good way to give insulin because you just dial up the dose and inject it with a very fine needle. This is another kind of insulin that comes in a pen, a newer insulin that's available for injection. This next pen is not insulin, but it's Byetta, which is a drug that helps lower blood sugar and lower weight. So it's actually a very nice drug for patients who are overweight, who have type 2 diabetes. And this is finally an insulin pump, which is another good way to give insulin.
Well, that pump looks very interesting, especially for a person who is challenged taking meds, because it provides a continuous dose, correct?
It provides a continuous dose, which you control with a little PDA monitor. It's really a fun toy, but...
But, there's always a but.
Well, no, you have to learn the technology, and technology is only as good as the person putting the information into it.
Of course.
But with a good doctor and a good team, and diabetes is a team disease. It's not just a doctor saying do this. It's often a dietitian, it's often a psychologist, a pharmacist, a diabetes educator. It's a lot of people to work together to get people's diabetes under control and keep it there.
Wow. There's so much to this topic. It's time for a short break, and when we come back, we will continue our discussion of a disease that affects almost 20% of Americans over the age of 60, diabetes. We'll be right back. Stay tuned.
Need a recycling center? Call 311, the toll-free number for non-emergency services. 311, your one call to City Hall. Graffiti removal? Call 311, the toll-free number for non-emergency services. 311, your one call to City Hall.
The Department of Public Works Bureau of Contract Administration keeps the city's projects on track, ensuring safety first and fairness always, from the streets all the way to the stars.
Welcome back to Aging in LA. Our topic today, diabetes and how to manage and treat the disease. Our guest is Dr. Ann Peters, professor of medicine at USC. She directs the USC Clinical Diabetes Program and sees patients at the USC Westside Center for Diabetes and the Edward Roybal Comprehensive Health Center. I am so tickled that you are here. I told you during the break, this is utterly fascinating and a growing problem. We all better get educated on this subject.
Well, yes, because it's one of the few diseases people have so much ability to impact. I can't say necessarily that I can tell you what to do to prevent cancer. I can tell you how to screen for it, but I can tell you how to prevent diabetes, and once you have it, I can tell you how to treat it so that it doesn't cause you problems. And Yet most people do not get the right care. Most people are not adequately treated for their diabetes.
Well, what about the healthcare community itself? Are physicians up to speed as you are? I mean, this is your baby here. This is your subject. Are you able to help physicians improve their knowledge of the disease?
Well, let's just put it this way. There is no money in preventive health care. So for every patient I see, for every dollar it costs, I get reimbursed about 30 cents. So there's only 2,000 diabetes specialists in the country, and we're sort of going downhill because the system is basically made such that I get money if I cut off your leg, or the healthcare system gets money for a procedure, not for prevention.
Wow.
So I am not common, and that's the problem. And I try to teach primary care doctors because they take care of 95% of all people with diabetes, but they don't have, A, the time or the resources. They don't have diabetes educators, and they might not have the time to focus on the disease. It's a complicated disease, and it's easy to say, here, take this pill, but then the lifestyle part that goes with it, all the interactions, all the things, it's very hard to do when you're dealing with, people's aches and pains and everything else.
Yeah, but this can overwhelm the system. These numbers aren't going down, they're going up, correct?
Well, that's why I think this is an epidemic, and that's why people really are caring about it, but we need to increasingly put the dollars toward preventive health care. Remember, insurance started to help you if you suddenly got bad sick.
Right.
Back when it started, we didn't have preventive health care measures, and so, but that's why people can learn about this. They can read books, they can look at the websites, they can say, what are my numbers? How do I track my numbers? How do I make my health better? And people who really take a role, get engaged in their care, can really make a difference.
Well, and I don't think this is just an individual taking care of themselves. Your message is important to caregivers, too, people who may be able to motivate even a senior to radically alter their, maybe not radically,
No,
but alter their
that's not
lifestyle.
radical. And it's not even a senior. It's
Well,
people who have benefit from healthier practices. High blood sugar levels make you think less well. They make you feel less well. They make your wounds heal less well. They make you, on a day-to-day basis, less healthy. If I lower your blood sugar levels to normal, I think people feel sharper, they have more energy, and I just think it's better overall. And it also lowers the risk of complications. So I think it's a very important thing to know and do something about because seniors are at such high risk.
Well, it's those complications. I know we have touched a few of them. The heart disease risk, you said 4 times the likelihood to have heart problems. But this is the whole circulatory system it would be involved here, right? You might have any kind of problem.
Oh, higher risk for stroke, amputation, peripheral vascular disease. The thing that's really important, though, is that women lose gender protection. So you think of a woman as lower risk of a heart attack than a man.
I always
but
have.
Not when you have diabetes. It's equal. So if you're a female at any age with diabetes, your risk is exactly the same as a male. And we see so many women, death rates of women with diabetes go up all the time because they're not so aware of cardiovascular disease risk. So women need to be aware.
Now, does smoking figure in this too? Is it
No,
another?
it's smoking.
Oh,
People
the
cannot
smoking.
smoke if they have diabetes. I'm sorry, it's not allowed.
No, I got you. Dr. Peters, when we visited you at your office at Westside Center for Diabetes, you showed us some test tubes that illustrated the amount of fat in certain foods. So let's take a look.
So these are test tubes of food, or the fat that comes in the food. And on the left, it's always higher fat. And there you see 1 tablespoon of regular mayonnaise fills up the tube. And a tablespoon of light mayonnaise is only half the tube. And remember, less fat is better, and less healthy fat is best of all.
Okay, boy, I don't think I've ever even had a spoonful of light mayonnaise. That's hard to believe.
Now this is crackers. So look at 10 Ritz crackers fills the tube, and 10 saltine crackers is about 1/3 of the tube. So obviously you can make better cracker choices.
Well, and that's a pretty simple way to reduce. I'm a cracker eater for sure. What about what goes on it, though?
Oh, well, okay, we're not even going there. Now look at this. This is a whole milk, almost entirely full, versus a cup of skim milk, just a teeny amount at the bottom of the test tube. So you can see that with the skim milk, you get all the nutrients, but you get a fraction of the fat.
Right, yeah, don't be confused by the label. See that little bit of white there that's on the right of your screen? That's the difference there.
That's unbelievable to me. It's just shocking.
Well,
And think of that inside your arteries. Think of that clogging them up. It's just not what you want to have.
No,
you really
I
need to
can
understand fat.
understand
And
that.
look at this. You go to McDonald's. On the left, a quarter pounder with cheese, 3 vials, 3 test tubes full of fat. On the right is a grilled chicken sandwich, and if you take away the mayonnaise on the grilled chicken sandwich, it's got even less fat. So you just really have to make wise food choices. And yeah, you can have bad foods for you from time to time. But if you learn what's good and what's healthy and you eat those most of the time, you're going to be much better off.
Well, having just had a birthday cake with like mangoes and kiwi and all the rest, that was pretty good.
I saw the icing on that cake, and that was high fat, and I did not have any. I want to point this out.
Good for you, but you must do what you say. You're the best advertisement for this, because I've learned more just in this little bit of time than I was amazed. Even though I'm looking at some of my favorite foods and going, oh no.
You can eat a little.
Oh,
Like just
okay.
that, I don't believe in dramatic diet changes. I
Okay.
believe in slow, gradual steps. You just need more education. And I think a lot of people who even eat relatively well can benefit from a little more education.
Well, one of the things for me is about exercise. You know, I grew up this is an Iowa farm family, and we ate what today people would go, oh my God, how could you eat that many eggs and the bacon? But we were working sun up to sundown. And when you're out in the fields and really exercising that way, I don't think diet is such a big, well, of course it's important, but it never seemed to impact my family. And folks lived into their 80s, and it didn't seem that they had these kind of problems.
No, I agree. It's the exercise plus diet. And when you're working like that, my family's from the Midwest too, and
So-
they all lived to be 100.
Yeah,
And
it's
they just ate
amazing.
farm food, but they were working.
Yes.
And if you're working and using your body, you don't get the same problems.
Sadly, our time is up for today's edition of Aging in LA. Thanks to our guest, Dr. Ann Peters, wonderful guest, professor of medicine at USC Keck School of Medicine, where she directs the USC Clinical Diabetes Program. The Los Angeles Department of Aging produces this program with CityView, Channel 35, so that seniors living in Los Angeles and surrounding communities are well informed on the many issues that face them in everyday life, and also to let you know of the many services that the Department of Aging offers our senior citizens. Now, we'd like to hear from you with comments on the program, what you like, what you think can be improved, and ideas for future programs. Please give us a call. The number's there on your screen, 213-252-4088. That's 213-252-4088. Call us with your comments and ideas. We look forward to hearing from you. I'm Paul Peters.